Welcome to the About the Face podcast, sponsored by the American Academy of Facial Plastic and Reconstructive Surgery through the Facial Plastic Surgery and Aesthetic Medicine Journal.
Hi, my name is Grace Zhang. I'm a fourth-year medical student at the University of Cincinnati College of Medicine, and today I'm here with my attending, Dr. Hsieh, who I'll let introduce himself.
Hi, I'm Dr. Hsieh, facial plastics faculty at the University of Cincinnati College of Medicine.
So the past couple of months, we've been working on a pretty interesting topic related to TikTok and health information, and it was recently just published titled TikTok as a Medium for Facial Paralysis Health Information, a Social Media Analysis. Dr. Hsieh, what led you to study facial paralysis content on social media?
I got interested in this because TikTok has exploded as a platform for health-related information. And facial paralysis with its visible impact seems to be a condition that might get a lot of attention. I wanted to understand how accurate or helpful the information on the platform actually is.
So it was actually pretty interesting to study because TikTok, unlike some of the other social media platforms out there, has its own algorithm.
Wait, so did you just Google videos and look for them on TikTok?
Okay, I know it's hard for millennial attendings to keep up, but TikTok kind of uses its own algorithm, and based on the number of likes and the amount of engagement that there is on each of the video, it gets bounced and pushed forward to other people's For You page, or like taken away from other people's For You page. So for this project, we kind of took the top 105 different videos and we sorted them by likes between December 3rd of 23 and then January 3rd of 24. And we used three main search terms, which is facial palsy, facial paralysis, and Bell's palsy. And kind of in our preliminary search, that was the ones that carried the most results. And then we had three independent reviewers, like all medical students, and then you kind of acted as like our fourth person in case there was like discrepancies or questions. And then we found two general like objective tools called Discern and PMAT, and kind of scored these videos for their health information quality as well as their actionability.
Okay, that makes sense. So we use Discern and PMAT tools. They're quite reliable for quality assessment. Discern is a widely used tool for evaluating the quality of health information. It was originally developed to assess written health information, so it's ideal for checking content accuracy, trustworthiness, and clarity. In our project, we rated videos on a scale of 15 to 80, with the higher scores indicating better quality. Then the PMAT, which stands for Patient Education Materials Assessment Tool, has a version called PMAT AV for audiovisual content. The tool assesses actionability and understandability, so it's very helpful for determining whether viewers can follow instructions or explanations in a way that is clear and easy to act on. We score the videos on a 100-point scale for these attributes. Grace, do you remember if using these tools pose any challenges?
Yeah, definitely. So since these tools are traditionally used for longer, more formal educational content, applying them to our shorter TikTok videos was an experiment, and we discussed this as a limitation. Usually, there are longer forms of writing in like articles and essays that Discern and PMAT are used for. They usually come with graphs and charts and like actionable next steps, whereas TikTok is built as a short-term media and short-term tool for entertainment. So a lot of times those like aspects of like a professional paper or professional article aren't brought up in these videos.
So what kind of results did we find?
So we found that out of our 105 videos, 11 of the most liked videos were made by healthcare providers with an average of 68,000 likes. And 8 of those videos were actually created by physicians. 3 of those authors we classified as celebrities, which means they already had a following of greater than 10,000. And then our most liked physician video with 133,000 likes was from a non-celebrity cardiologist regarding facial palsy. Our videos had like a huge range of likes, but by far the most number of likes was a video with 1.6 million, and then the minimum number of likes from the top 105 videos only had 1,581. Most of our videos that we found were less than 30 seconds in length, and the most popular author type were celebrities, which meant they already had 10,000 followers. Most of our videos were testimonial in nature as opposed to being informational, a reaction video, or advice. And across the board, we had a pretty even distribution between neutral, positive, and negative videos in terms of tone. And then we kind of took a look at the videos we were actually able to classify with discern. So our average discern score was pretty low, and we were only able to score 11 videos that scored above the minimum of 15 out of 80 using the discern methodology. But we found that those that were able to be scored were statistically significant for being made by a healthcare professional, were longer, more informational, and had a positive tone.
That makes sense. TikTok's algorithm does have a major role in what gains traction. Anything surprising in your results?
Yeah, so we found that 11 of the top liked videos actually came from healthcare providers, but the majority of our videos scored very low on discern. So this really highlighted the variability in the quality of information that, the average user on TikTok is exposed to.
Definitely. And it is a bit concerning that only 11 of the top liked videos came from healthcare providers. But it's good to have these findings. How do you envision this influencing physicians' engagement with social media?
So we're kind of just suggesting that physicians become more aware of the types of information that's circulating on social media. TikTok's reach is very vast, especially amongst the younger demographic, and many people are in fact using it now for healthcare information, despite it not being very actionable like we saw or very accurate. So I feel like by understanding what's out there, physicians can better address any misinformation or any questions that may happen when they see patients.
I agree. I think focusing on awareness rather than pushing every physician to join TikTok is more feasible. I know that there are limitations in terms of where a physician may work or who they may represent, so TikTok at its current stage is a supplementary tool rather than a primary source for patient-physician interaction.
Yeah, we hope you all enjoyed listening to our brief podcast, and be sure to check out our research letter published soon.
Thank you.
We'd like to thank the authors for their commentary, and thank you for listening to our podcast. If you'd like to explore more, please feel free to check out the article in print at the Facial Plastic Surgery and Aesthetic Medicine Journal or online. We'll catch you on the next one.